Okay. And let me also try to live stream this. 1 second. Okay.
This is very fancy, Susie.
Yes. I'm hopefully I'm hoping it's going to work. Oh, it's telling me I don't have permission. So you know what? Forget the live stream. We're just going to do the Zoom. I won't be sorting that out for now. Okay. Okay, so welcome everybody, right, to an interview. And I promise this is going to be a very interesting interview today. For most of you know me, most of you are my clients, or some of you follow me on Facebook. But just in case you don't know me, or if you're watching a replay, I'm Susie Foreman, and I'm the co-founder of the Joint Pain Relief Program. This is a program for people who have hip and knee osteoarthritis, and they want a natural way to lessen their pain, lessen their need for medication, and improve their strength and function so that they never need to have joint replacement surgery. So welcome everybody. And today I'm very excited because I'm interviewing a longtime friend and colleague of mine, Theven Sabga. And Theven and I worked, can you believe, Theven, 20 years ago in Toronto,
21,
downtown
actually.
Toronto.
21, right? Yes.
Right. So let me introduce Theven. So Theven, like me, is an older and wiser physiotherapist. With over 30 years experience, she has a lot of knowledge and experience treating clients with pain, and she's now niching down on clients with chronic pain. Theven is also a yogini and a wellness coach. Years of practicing Eastern medicine and her wellness coaching have inspired her to integrate both Eastern and Western philosophies into her practice. In her work, she has come to learn that there is so much more to chronic pain than just the physical dimension. So I am very, very excited to have Theven. She's going to share a lot of wisdom with you today. Theven, welcome.
Thank you so much, Susie. I'm so excited to be here and excited to speak about this topic that is complex and I think is in so many, like if it's not chronic pain, it's the symptoms of chronic pain that influence and bug so many. So,
Right.
yeah.
Right. It's it is a big issue, and many people do suffer from chronic pain. So with that in mind, Theven, I mean, years ago, so we're going back 40 years now, when I went to school, chronic pain was defined as pain that went on longer than the standard time that it would take for tissues to heal. And most tissues they teach us would heal in 6 to 8 weeks, maybe 3 months. So is that still the definition of chronic pain today, or what is the definition of chronic pain?
The official, textbook definition is pain that goes on for more than 6 months.
Okay.
So, when we look at acute pain, there's tissue damage. The body has a specific time frame to heal that.
Yes.
You have a sprained ankle, takes about, as Susie said, 6 to 8 weeks to heal, all done. In the cases where that pain goes on, tests are coming back negative, CTs, X-rays, MRIs, blood work is coming back negative, it falls into that question mark, what is going on? There's another definition, chronic pain associated with chronic diseases like osteoarthritis or Crohn's disease or a neurological disease. So yes, that specific disease needs to be treated medically and however we approach it. But when lifestyle becomes a problem, when chronic pain is affecting your lifestyle, then it does need to be addressed. So basically, pain that goes on for longer than 6 months, it can be undiagnosed chronic pain or diagnosis with a specific disease process.
Okay, so you actually have introduced me to this model, this neuromatrix theory biopsychosocial model.
Right.
This is one of the recent theories around chronic pain. Can you speak more to exactly what is it? What is the neuromatrix theory?
So as humans, we are complex, really complex beings. And
Damn simple.
Ah,
Right.
and therefore, looking at pain, chronic pain, requires a multi-dimensional perspective. And this neural matrix theory is really applied to the brain. It looks at, we're getting a little bit nerdy now, biopsychosocial. So the biological is, you know, the medication, the tests, the physical nature of the pain. The psychological, I'm just going to give a brief overview and then we'll dive in. The psychological is the emotions that are associated that can amplify or decrease pain. So things like fear, stress, anxiety,
Right.
overwhelm, the feeling of being isolated. And the social piece is the cultural piece and relationships and how all that. So all this together, all this coming into one gives you that multi-dimensional perspective. And with chronic pain, everything needs to be looked at. Everything. Because
Right.
everything influences chronic pain. It's not just the physical. It's
Right.
yeah.
Mind, body, spirit, soul.
That's right. That's
Right.
right. Yes.
Okay, so I mean, if we're looking at mind, body, spirit, soul, emotions, yeah, it makes total sense to me that, you know, emotions are going to feed into pain, and there's that whole body, what is it? I guess would that come under psychosomatic or emotional somatic?
It comes under psychosocial, and here it
Right.
is. When we talk about the psychosocial piece, you know, the reaction of many people is, don't talk to me about that because this has got nothing to do with my pain. But there needs to be an understanding of how the brain and the body works. So chronic pain is physical and it is emotional.
Mhm.
It's a combination of both. And to look at, firstly, there's, you know, we know so much more about the brain now than we knew 10 years ago.
Right.
And you know that there is not just one center that is responsible for pain. It's a confluence of many, many, many centers that then cascade. There's hormones secreted, chemicals secreted, and then this effect is cascaded into the body.
Right.
To get deeper into it, when we look at the spinal cord, imagine that it's like a superhighway of messages being transmitted from the body to the brain.
Mhm.
And, you know, as physios, we know the gate control theory.
Right.
Imagine there's gates that open or close as this information is being transmitted to the brain. There's certain things that open the gate and certain things that close the gate. So when we look at the amount of information up and getting to the brain, feelings like fear, anxiety, stress, all those open the gate and
Right.
amplifies the pain response. When we talk about being in fright mode, that
Mhm.
sympathetic state, that opens the gate. Now we've switched to the opposite, being in rest and digest, in that parasympathetic, more relaxed state. This closes the gate. And
Right.
this is how we can reduce the pain experience. I don't mean to say experience as in something good, because the pain experience is certainly not pleasurable,
Right.
but we can influence that. Yeah.
Okay. Okay, I get that. I get that, and it's you know, when I think about what you're talking with the parasympathetic and sympathetic, also when they teach us acupuncture, they talk
Mhm.
about that. Okay. Now, you know, there are many people who will look at others, they can't see swelling, they can't see redness, they can't see inflammation, they don't see a broken bone. So then they tell these clients, it's all in your head.
I
You want to
know.
talk about that?
Yeah, absolutely, because I hear it so much, and it's in the medical community and as well. Like, you know, and it can be looked at as being derogatory, and I really don't feel like physicians aim for that to be said in that way. But at the end of the day, the experience is computed in our brain, and when it's gone beyond that tissue healing phase, then beyond the physical dimension, how are we contributing in the way we think about our pain. There's something like you can have the physical experience of pain, but how do you feel about that pain?
Right.
Right, is the major component. And when we start looking at managing it on that psychosocial level, we're looking like at an inner reprogramming. The brain is very neuroplastic, meaning things can be learned and things can be unlearned. So when a specific thought is on a loop,
Right.
you're creating a specific pathway over and over. It's a habitual pattern is set up. When you realize and become aware of that and try to undo that pattern is where the inner reprogramming is.
Right.
So that it's all in your head, it doesn't mean that it's not real. It's very real. It's very real. It's the experience of pain. And this experience of pain, you know, it's dependent on past experience, on your feelings surrounding that pain, on your beliefs about pain, your expectations. Sometimes it's just the expectation of what could happen, the danger perceived. Alarm system is turned on so loud, like cold air is going to bother me. And before you just thinking about
Right.
amplify so much.
Ramp it up.
Ramp it up. Yes.
Ramp it up.
Yes.
Okay. You know, but sometimes I do wonder though, you know, when some of the practitioners who do say to clients, or it seems like the clients are hearing, it's all in your head. Sometimes, unfortunately, it's practitioners aren't up to date. They don't understand.
That's right. That's
right. Which is very unfortunate.
And that in itself, you know, that if that is the perception that the client leaves, it creates an unsafe environment. That unsafety as well, the feeling of not being heard, feeling isolated, it all adds in. It all adds in into this pain experience. So
it's like a compounding effect.
That's right.
Right. Yeah, very difficult. Thankfully, chronic pain is becoming more and more of a specialty, you know, and people are understanding, practitioners are understanding that, you know, you don't have to have anything visible in front of you. You don't have to have a swollen joint. You don't have to have blood flowing out of something. You don't have to have that. I mean, even just recently for one of my young patients, I have a 14-year-old girl with very classic patellofemoral runner's knee, very classic in young teenage girls. And her mother is not believing her when she says she has pain, even though her symptoms are very classic. And her mother's like, well, your x-rays are normal. And I'm like, well, she's 14. She's not going to have anything on x-ray yet. So it's tough.
It's tough. Really tough when something isn't visible.
Right.
And that's it. In learning how to communicate, that's that social piece, learning really how to communicate your symptoms to close family, friends, and to the healthcare professional, right? What to communicate and how to communicate. This becomes an important piece as well in being heard.
Okay. And the biological component of pain, what exactly is that when you say the biological component?
Biological component is that physical aspect. So it's the actual injury, could be the acute stage of the injury. It could be all the tests and the medications involved. And then there's a neurological piece, because that connection between, as I described, between the body and the brain, and how that is being processed. So the biological piece is what we as physios and the medical profession take really good care of.
Right.
When you are addressing pain, the biological piece needs to be taken care of. Absolutely. You know, osteoarthritis, you need bracing, orthotics, the exercises, the medication, all that. But when it goes beyond protecting these mechanically damaged tissues, and it's affecting lifestyle and relationships, and it's creating frustration, and that's when these other pieces then need to be looked at. So biological is totally really the physical dimension.
Right. Okay. Yeah, by the time most of my patients come to me, it is not just biological anymore. They've certainly got the biological, the pain, the swelling,
Mhm.
and your classic symptoms you see as a physio, but it is now interfering in their lifestyle. And I do hear frustration from clients. I do hear fear. They don't want to have a joint replacement. I do hear all of that. So very important that we address and realize that these issues are out there,
That these
right?
issues are out there, and finding, like setting goals and setting realistic goals,
Mhm.
and being able to navigate with, if you have a diagnosis, being able to navigate with this diagnosis, what what are the do's and don'ts, what I can do, what I can't do. And I see so much fear of change,
Mhm.
fear of unexpected outcomes, or fear of things repeating itself, a bad experience repeating itself. And those are the pieces that need to be worked out. And really, within the clinic system, when I worked in the clinic system, I'm principally now working as a wellness coach addressing chronic pain.
Right?
My scope then didn't allow me to address these other pieces. And as amazing as our medical system is, we don't have the luxury of time, right, to really multidimensionally address these other pieces
Right.
fully.
Right. Right. Right.
And it does take, I'm going to say, to address chronic pain, it doesn't take one practitioner. I think you need an umbrella of care. You need more than one.
Mhm.
And becoming aware of that, and a really effective self-manager, realizing I need more than one healthcare practitioner taking care of me, is really important as well.
So, well, let's expand on that a little bit. When you say you need more than one, who else would you recommend that if you were taking if somebody was coming to you for coaching and wellness coaching, what other practitioners would you have in your back
Mhm.
pocket, say?
So it depends on what is being experienced,
Hmm.
but certainly medically, I would want them, having the appropriate tests, images, and
Right.
being cleared for all the red flags and being followed by their physician. Now, if there's other more severe um, psychological issues like severe depression or
Right.
any psychological disorders that go with it, there might be a psychologist, generally not a psychologist, a psychiatrist involved.
Right.
Um, as a wellness coach, I'm working closely with, naturopaths
Hmm.
and nutritionists, although we do cover, uh, there's a big, place a lot of attention to food. Um, feel that
I'm
it's
going to get to that. I'm coming to that.
really important. But again, if there's a deeper dive needed, then yes.
Okay.
So depends on the challenges that are coming up and what is in my scope and what is out of my scope, that we include other people. But it's generally more than one practitioner that's needed.
Right. And you know what? You keep mentioning fear, and you mentioned images. One thing I'm constantly telling a lot of my clients, because even in my Facebook comments, even when I'm interviewing people, a lot of people are, well, what if I have bone on bone,
Mhm,
right?
mhm.
And do you follow Baram at all? Baram Jam?
I'm not avidly, but here and there, yes.
Okay,
Put
the
some
reason
good
I
stuff
bring him
out,
up,
but
so for
put
all
some
you
really good
clients that are
stuff out.
watching, Bram Jam is a very well-known physiotherapist amongst physiotherapy community, because he does a lot of education for physiotherapists. He has this acronym, which makes me a little queasy, because it's vomit, right?
Oh,
Right? You've never heard it,
no,
right?
tell me.
So it's victim of medical imaging technology.
Ah,
So for everyone, what he's talking about there is, he's talking about, just be careful that you don't become a victim of your images. Images do not dictate function or even outcome. Okay. So let me just speak a little bit more and give you an example. If we know this, we all know this, that if you were to go out in the general public and take images of people walking around on the street perfectly fine, there would be findings. There are many people walking out there with, degenerative disc disease, many other things going on, yet they're not um, they're not um, they're not having any symptoms, right? Ruth, I'm just going to ask you to turn off your video there for me, please. Right?
Because it's being recorded.
Yeah.
Yeah.
And so many people are out there with findings. If you go and take x-rays, images, you'll find stuff, but they're not symptomatic.
Okay.
And here's another example of why you shouldn't let your images dictate or make you fearful. I interviewed a client recently, and last summer his knee pain was 8 out of 10. And he was walking and just thinking he'll just push through it. Then he got wiser and decided not to do that. He started cycling instead. The cycling did two things. The cycling strengthened up his quads, which are one of the muscle groups that are important to strengthen. There's more, but the cycling also helped him to lose some weight. He lost 15 pounds. And so between those two things, his pain went from an 8 to a 10. Now he is joining the program because he wants to now don't listen to that. Okay, his pain went from an 8 to a 3, an 8 out of 10 to a 3 out of 10. Okay, and now he's joining the program because he wants to get rid of the 3, which I think is very doable because he hasn't been strengthening the other muscles that matter. But his x-rays haven't changed. So I'm telling you this story to show you, do not let images make you fearful. Do not let them make you think, oh my God, this is doom and gloom and the end of it, and I'm going to have a joint replacement surgery, because it's not true. You can see, I've seen it in many of my clients over the years, and especially in these last 2 years treating this program, you can see intensity of pain go down, need for medication go down, and function improve, and yet people's images have not changed. So there we go. That's my little piece on fear and anxiety.
No, that is so well said, because so often, as Susie mentioned, we see these images, sometimes the images are not so bad, and clinically the patients are presenting worse than
Yeah, we can get the opposite.
or the opposite. The images are really like, oh my God, it's bone on bone, but somebody is running marathons. So, yeah, that's just really important. And just to segue into the fact that, with chronic pain, the connotation like, oh, your pain's going to be there forever. I think people need to know that you can be an effective self-manager. You do
Yes.
have control. You can change this. You can undo.
Yes.
We don't hear that often enough, or we don't say this to clients often enough.
Yeah.
You do have control.
Yeah, actually, there's research out there that says, just as practitioners saying to the patient, this will get better, goes a long way. There's actual research behind that.
That's right.
And even just up to yesterday, I did a short video on mindset and the power of positivity, because having that positive mindset will make us take the positive actions to then get the positive outcomes.
That's right. And to take it to a nerdy scientific level, when we're having a negative mind loop going on, it's firing up the amygdala, you're getting cortisol, you're getting this chemical overload that's causing the tension and causing these feelings, whereas the opposite effect of serotonin and dopamine when you're more relaxed is creating a whole different environment for you to function in.
Right.
And you have control over that. That's
so we've talked all about emotions, we've talked psychology, etc. Let's get to food.
Yeah.
Because me, love to eat. Let's talk about food. Let's talk about food and the gut-brain connection to chronic pain and to the neuromatrix theory.
So the gut is being referred to as the second brain.
Yes.
The gut secretes more serotonin than the brain itself. So I've learned. So if we are eating foods that disagree, whether it's gluten or sugar or heavily processed, and your gut is not happy, it's going to just add into that pain experience. Right. You are what you eat. Your well-being begins in the kitchen. It's next to sleep. It's the number one or number two, choose whichever one you want.
Yes.
Very important. Both are very important, simple, but very important. You need to place a lot of emphasis on what you're putting into your system and keeping your gut healthy. And, even if it's not organic, actually as fresh as you can.
Right.
If you can't access fresh, flash frozen vegetables,
Right.
and I'm not here to promote veganism or vegetarianism, but stay away from the heavily processed foods. And I say, when you get to the grocery store, shop in the outer aisles first. Fill your cart from the outer aisles,
Right.
then go to the
or I refer to it as one word eating: chicken,
chicken,
rice,
yes.
broccoli. Right. One word eating. Right.
Yes,
Yeah.
very, very important.
Yeah. Okay, I will. I mean, in this series, I'm hoping ultimately to be interviewing practitioners more to delve more into gut health and just even more and more details and specifics. And also, you mentioned sleep. Want to touch on that?
Yeah. So sleep,
I'm a
right?
don't mess with my sleep kind of girl.
You said that, yes.
Right.
So important, right? I mean, some people need 8 hours, some people need less. It's about getting into that deep. We go like when we are communicating right now, we're in beta, but it's going into alpha, theta, and getting into deep sleep. So when you wake up, you are feeling like you've been reset, you've been re-energized, because during sleep, the body is actually repairing itself. And if you're not getting into that deep restorative sleep, you're going to get up and feel like you've been run over by a truck, right? I'm sure, like we experience that. Sleep is really important in dealing with pain.
Yep.
So setting up good bedtime routines, like, trying to go to bed at the same time, creating something more relaxing, not looking at screens before, even, employing, if you do meditate or yoga or something more relaxing, temperature of the room. There's lots of tips to go with sleep, but a lot of attention needs to be given to a good night's sleep, and naps during the day if you need it,
Right. Right.
Yeah.
Yep. Like I said, don't mess with my sleep
Don't
because
mess.
you will wake the bear. You'll be poking the bear if you mess with
And
my
I'm
sleep.
sure a lot of you experience, like, if you haven't had a good night's sleep, you're not in a good mood. So put chronic pain on top of that. It's just,
Right.
just amplify things.
Yes. Yes. Now, we talked, so you mentioned social, right? Cultural, right? Because, for instance, I mean, this is stereotype now, but they would talk about British people being stoic, and then there are other cultures that are more passionate and may feel pain more or express pain more. Let's talk a little bit about culture.
Yeah, so I'm glad you brought that up, Susie, because it's how were you brought up regarding pain? So when you were little and you had a boo-boo, did your mother say, "Oh my God, what is going on?" and made a big deal of it? Or it's okay, forget about it, right? Because the way you deal with pain is established.
Programmed.
You're programmed. So that has your feelings about pain, your behavior around pain is important. And that comes from that cultural piece. The other piece with social is your relationships. Like, how can you freely express and get support with relationships, be it with your spouse or with your kids or with your siblings, your family, your extended relationships, moving into your professional world as well. And then the healthcare system, right? Being able to communicate effectively and feel the support. It's all about the support. When you are feeling supported and you're creating this circle of support around you, it makes a huge difference. So that social piece, again, to be navigated and knowing where the problems are, right? Yeah.
Yep. Yeah, no, like we said at the beginning, body, mind, spirit, and soul.
Body,
I
mind.
truly,
Yes,
I
yes.
truly believe it all needs to be addressed for wellness, for
It
wellness.
does. It's a multi-dimensional perspective, and you can see how this biopsychosocial, it's not in your head, but
Right.
it all plays into the experience of pain. Yeah.
Okay. Um, have we touched pretty well on everything? Should we open the floor up to questions?
Can, and what I wanted to say was with I want, if we have some time, we can have a question and answer.
Mhm.
But I wanted to just touch on something that I think has had a powerful effect for me, was just my own training as a yoga teacher, meditation, but specifically with the breath. The
Right.
breath is so powerful. We have the ability to hack the nervous system with the breath. And I will ask this question and just think about it. How do you breathe? How do you breathe when you are feeling really worried about something? Or how do you feel when you are feeling joyful?
Right.
How do you breathe if you've just won a lotto ticket? You could see that the breath is connected to emotions.
Right.
And with the breath, you can actually shift from that sympathetic state into the parasympathetic mode. So often we're rushing through life being upper chest breathers. How often are we sitting back and taking a deep, intentional abdominal breath?
Right. Right.
The breath can be used in many ways. It can be used to relax you. It can be used to energize you. It can be just used in many, many, many ways. So if we have time, I would love to be able to take the group.
Oh, we will.
Yeah.
At the end, we will. So
Yeah.
you said it will take about 5 minutes?
Yeah, we could take 5 minutes. We could take
Okay.
5 minutes and I could take you through a basic abdominal breath
Okay.
sequence, and something that I would encourage you all to do. We'll do it for 5 minutes now. And if you are feeling, if ever you've said, and I hear this all the time when I suggest meditation to people, and they say, I can't meditate. My mind is too busy. I can't meditate.
Right.
Well, if you say that, you should be meditating.
I should be meditating.
But it's very difficult to sit down with a busy mind to meditate. So the breath techniques that I go through is one way for calming the mind. And why am I bringing this up? Because it sets up the body. Like if you are feeling like there's one thing in about being in this sympathetic, the state of angst,
Right.
thoughts, but there's a physiological process that goes on in the body. You might feel your heart racing. You might feel sweaty palms. You might feel like, I'm trying to calm my body down, but I can't. Well, the breath is one way that you can physiologically settle the system down.
System. Okay. So yeah, so we'll definitely do that at the end because I'm looking forward to that. And yeah, I'm one of those people that should be meditating because I'll tell you that my mind is racing. I'm getting better as I get older. And I'm laughing now because I remember you telling me your husband would try to meditate and just fall asleep.
Yeah, he would fall asleep all the time.
Yeah.
He said, busy, busy. He
Yes.
can't sit still for a second, but
Okay.
slowly now with breath work, it's opened the doors.
Okay.
That was the tool.
Now, I don't know if have you been seeing the chat, Theven?
I am going to open it right now.
Yeah, so there's no questions yet, but if anyone wants to ask questions of Theven, and I'm also going to be putting links in the chat shortly, so that you can reach out to Theven, and I'm going to putting links for, well, most of you know me, but just in case you don't know me, I'll put links for my program as well. But Nettie, I see, yes, about the MRI really depressing you and you got mad and stopped the meds. And I'm glad to hear that you're doing better. I know we chat here and there. And Tina, yes, everything about support. Yeah, if you're not
Yeah.
supported, all right. And Hillary, I hear you. Work shift is very hard on sleep. I personally, years ago when I was thinking about what I was going to do, I thought about nursing temporarily, like for 2 seconds. But
Mhm.
shift work was like, forget it. That's not going to work with me.
It really messes with biorhythms. So I'll speak to some of this. So when the MRI really depressed you, yeah, so that created an emotion. This is from Nettie. It created an
Yeah.
emotion that you needed to process, that you needed to talk through with your healthcare professional, so you understood it. You stopped the meds. We're not sure what happened by stopping the meds, but you could see how these things can play in to it being, if you have knowledge is power, right? Knowledge is power. So getting the knowledge around something, you are aware that you had this reaction, but now getting the knowledge to empower you to take the right steps. And getting support, yes. And Susie said it too. It's everything. It's decreasing the threat. The more we feel danger in our environment with chronic pain, the worse it gets.
Yeah.
Right? On many levels, on so many things that we addressed. And then with the work shift, yeah, it really affects the biorhythm. So I would say if you're switching shifts, it's just trying to create some kind of physical routine before you sleep. Taking natural supplements is good. The breath work is wonderful and calming because you need to segue, right? You need to shift into, like, slowly step it down. When we talk science again, it's that beta, alpha, theta,
Right.
and then go into the deeper. So we need to slow the brain waves down. Watching screens and watching TV is not doing it. Reading help. So yeah, any questions?
Yeah, anybody have any questions? Please just pop them in the chat. Oh, come on, don't be shy.
Exercises have really helped. And connecting, yes, it is tough. It's over COVID and post-COVID, but strengthening, great. And Susie, I think you're doing a great job here with making it so accessible to your clients. So strengthening around the joints, and the perception that movement is bad, movement is gonna hurt. That's something we need to address, because hurt doesn't always equate harm, right?
Right.
Is it post-treatment soreness, which is okay, or is your pain actually getting worse? So the education around that piece is important.
Yeah, I have an infographic that I share with a lot of my clients. Right. Can you turn off your camera, please? And then just put your question in the chat. All right. So yeah, so the infographic that I share with my clients, because I mean, years ago, remember, we used to say to clients, well, let pain be your guide. So then there were kind of two ends of the spectrum, right? You've got the people who'd feel 1 out of 10 pain and they'd stop everything because they're doing more damage and they'd be so fearful, right? And then they'd sit on the couch and get weaker and weaker and weaker, and that just did them no good. And then I have other people on the other end of the scale, quite a few in my program, who are like, oh, it's 8 out of 10, I'll just work through it.
Yeah.
Right?
And
So I have this infogram where 1 or 2, we don't worry about it at all. Up to 5 is still acceptable, but anything after 5, you need to stop. And so if somebody's doing something and they get a 5 out of 10 sharp pain, they need to stop the activity. Or let's say they go out and they go for a walk and the pain goes up to a 4 out of 10, which is acceptable. The 4 out of 10 needs to settle right back down to 0 within 24 hours for it to be acceptable. So those are kind of the guidelines I'm using with my clients these days.
That's really good, because it's objective. You're getting them to put a number on it.
Yes.
And really understand. Yeah. Knowing when to stop is important, but knowing when to go, it's a fine line.
Right. Yeah. See, Evelyn's written that she's finding it difficult to determine what is the correct level of activity. Evelyn, I'm going to put in my email. If you email me, I will send you that infographic, okay? On which will guide you.
Pacing, Evelyn, is really important too.
Yeah.
So it's very individual. Pain management, your pain is unique to you, because there's other things that are playing into it. So knowing how much you can do and addressing, as Susie said, putting that number and understanding, if I do this, it creates this. So playing with it to trying to understand where you land.
Right. Okay. Yes, Tina, I can send you the infographic as well. And for the other client, so what's the best thing to do to take out the pain from having osteo? Okay. So The first two lines of defense, if you've got osteoarthritis, okay, especially in the weight-bearing joints, the first two lines of defense, weight control, which, trust me, it's challenging, right? I know. But also strength training of the appropriate muscles. And in my program, I incorporate the top program in Canada now, and it's all research-based on the muscles that matter and the coordination of muscles and functional movements that matter for people with hip and knee osteoarthritis. So everything about the program is research-based, including the fact that it's twice a week, and the exercises that it contains. But the first two lines of defense are weight management and strengthening exercises. Hillary, yes, Charlie is your movement program, right? You've been doing fantastic. I know, right? And your movement program is a border collie. I'm very physical, but do overdo it, being off the grid, and sitting is worst for me. Yes, sitting can be bad. Prolonged sitting just leads to stiffness in the joints. We know that our joints are lubricated and nourished with
Mhm.
movement, especially with weight bearing, loading and unloading of the joint.
That's right. So it's good that you realize what's aggravating you, so you know how to pace around that too.
Okay,
Mhm.
before I forget, I'm going to pop Theven's links in the chat. So if anybody's interested in working with Theven, I highly recommend her. Like I said, we worked together 20 years ago. Phenomenal
Susie
lady
Nick
and
is my son.
therapist,
Thank
right?
you.
Let me just get to that. Oh, Theven, I had it and then I lost it.
Okay. I will put in, I'm fully booked from, as I said, from Friday on to the 31st, but I'm offering 2 complimentary discovery sessions, and you can book that, I think, Monday or Thursday this week. I'm just going to pop that into
Yeah, so you pop that into the chat. Actually, instead of me looking for it, you could also pop all your stuff into the chat.
if anybody wants to contact me, I'll put in my email.
And your website, your Instagram, just
So,
drop it all in the chat.
oh, wait,
You're asking if physiotherapy and acupuncture will help too. Well, the physiotherapy is a strengthening. It really depends on what stage. I mean, if you've just twisted your knee yesterday and it's swollen and hot, then you may need physiotherapy in person. Whereas if you just have a chronic ongoing pain because of arthritis in the joint, that's where the strengthening program comes in. You don't necessarily need hands-on physio. It's strengthening. It comes down to strengthening. Acupuncture can help with the pain too. I am a believer in acupuncture, but I honestly, if I had one thing to give all of my patients, not just my hip and knee patients, but everybody from the jaw to the big toe, if I had one choice for all of my patients, it would come down to strengthening.
absolutely. Staying active and protecting the joint. Yeah.
Yep.
So Facebook would be.
Okay.
And I'll just put in my Instagram
Yep.
as well.
Excellent. So everybody on the side in the chat, you can see all the ways to get into contact with Theven. And she just mentioned that she's offering, you said 2 free discovery.
Yeah, they're 45-minute calls.
Okay.
So I think I have an availability tomorrow afternoon and Thursday afternoon. And
Okay.
the other thing is you will see a link. I'm putting out a book. It's in print.
Yes, that's right. Theven has written a book. It's in print right now, I believe.
Yes, it's in print right now. It'll be out in about 3 weeks. It's called Heal Your Chronic Pain.
Yes.
Integrated Approach. And there'll be a link directly to Amazon from my website. So you can just keep,
Okay, I'm looking forward to that.
Yeah.
Very much looking forward to that. Any other questions?
Comments? This was wonderful. I love that everyone interacted and
Yes.
shared. That's really great.
Okay, if there are no other questions, if you want to lead us through the breath work.
I will. So everyone, this is just going to be really relaxing and fun.
Sorry, can you, sorry, I only have you down as 365419. Actually, if you can email me, that is the easiest way I will respond to you. Okay. So you email me at Susie_Foreman@hotmail.com. Okay. So if you reach out to me, I will just send the stuff back. Okay. You make that first move.
So I'm going to take you through a very basic breath work. It's called abdominal breathing. It's really the first breath technique to learn.
Okay.
There's many to learn, but this is one that can you can employ any time of the day. Nobody needs to even know that you're doing it. Right now, we're going to close our eyes and we're going to sit back and we're going to relax. But really, taking these deep abdominal breaths is wonderful for resetting the system. So I invite everyone to just sit back, close your eyes, relax your forehead, relax your cheeks, let your shoulders drop down as you take a slow inhale through your nose, inhaling into this moment, bringing yourself present, and a slow exhale through the nose, letting go of any busyness and mental chatter. Again, a slow inhale through the nose, taking in focus, clarity, decisiveness. Take that breath all the way into the belly. Exhale any frustration, chaotic thoughts, and fear. One more time with the eyes closed. Inhale through the nose, deep belly breath. Inhale into your place of power, knowing that you are enough. And a slow exhale, exhaling any negative thought patterns or beliefs you no longer need. Keeping your eyes closed. Take an inhale through your nose, guiding this breath all the way into your belly, feeling your belly rise in all directions. And a slow exhale, feeling your belly go in. Let's try this again. An inhale, feeling that cold air at the tip of your nostrils, guiding this down, following the breath all the way into the belly, feeling this expand. And now a really long, slow exhale, trying no sound of your breath, exhaling from your belly all the way to the lower lungs, middle lungs, upper lungs. Now we're going to add a count to this. We're going to inhale to the count of 4. Inhale 4, 3, 2, 1. Exhaling 4, 3, 2, 1. No sound of your breath. Inhaling 4, 3, 2, 1. Exhaling 4, 3, 2, 1. And again, inhaling 4, 3, 2, 1. Exhaling 4, 3, 2, 1. We're going to inhale for the same count, but the exhale is going to become a little longer. Inhale 4, 3, 2, 1. No sound of your breath. Exhale. 6, 5, 4, 3, 2, 1. One more time. Inhale. 4, 3, 2, 1. Exhale. 6, 5, 4, 3, 2, 1. Keep going at your own pace. When you breathe like this, you're actually stimulating the body's own healing system. Your brain is like its own pharmacy, dopamine, serotonin, all these good chemicals. As you make the shift from the flight fright state into the rest digest, it's a much better environment for your body to be operating in. And the more you can control that exhale, make it twice as long as you inhale, you'll actually feel your thoughts settle down. Say as often as you can during the day, stop and take a few deep abdominal breaths. You can take it in for the count of 4 and exhale for the count of 4. But if you can prolong that exhale, even better. Finish your last round, whether you're inhaling or exhaling. Then I'll invite you to softly open your eyes.
You got the perfect voice for that too. You have a nice calming voice,
Good. Love to
right?
do a lot more. I mean, breath work is phenomenal. I can get very carried away with this, but that was just a little taste.
Yes, that was good. That was
Yeah,
good. Yeah, very calming.
good.
You can just feel everything just ramp right down.
Yeah,
Ramp right down.
it's a good one to do before sleep. Well, thank you,
Okay.
Susie. Thank you for
Yes.
making this. You're like the meaningful messenger here, bringing this together. I love what you're doing.
Right.
And,
No, I actually really
what-
enjoy this and enjoying stuff. And of course, it's even double enjoyable when it's a longtime colleague and
yeah,
friend.
I know.
Right. Right. So thanks very much, Theven. I really enjoyed having you this afternoon and interviewing you
Thank
and bringing so much value to my clients. And I'm sure there'll be many people watching the replays.
Mhm.
And in good health. Stay well.
Well, everyone, all the best and thank you. Enjoy the
Okay.
rest of the Sunday.